Join me on an inspiring journey through the world of fitness, health, and performance with the Genetic Coach, where I delve deep into the genetic foundations of athletic endurance, discovering how genetics is revolutionizing our understanding of human potential and how we can unlock our full athletic capabilities through a fresh perspective on conventional practices. Welcome to the Genetic Coach, the show where we explore the intersection of health, genetics, and fitness, helping us to live stronger, healthier lives. Today's topic is deeply personal and incredibly inspiring. Living with Li-Fraumeni Syndrome and returning to health and fitness after 3 cancer diagnoses. My guest today is Dr. Dana Elia, an integrative and functional nutrition expert with over 30 years of experience. She's a registered dietitian and leader in her field. She's had multiple roles on the executive committee of dietitians in integrative and functional medicine and contributed to the Academy of Nutrition and Dietetics. She is the author of the Stem Cell Activation Diet and the Sugar Detox Diet for 50 plus. Now, Dana's story is one of courage and determination. She's faced autoimmune disease since childhood, battled a rare sarcoma, and survived triple-positive breast cancer. Genetic testing revealed she has Li-Fraumeni Syndrome, a rare condition that dramatically increases cancer risk. But despite her many setbacks, she continues to thrive and contribute so meaningfully in the functional nutrition space. So I'm thrilled to have the opportunity to chat with her today. So Dana, thank you so much for joining us and welcome.
Thank you. Thank you for having me and giving me the space to talk about Li-Fraumeni.
Which I think is really important part of this whole conversation that we having. So to start off with, can you share a little bit about your experience with Li-Fraumeni and your whole cancer journey?
Yes. So in February of 2021, a screening mammogram, my annual mammogram, saw a very, very small something, something suspect. It was up against my chest wall, so it was something that I would not have been able to even feel myself. So they called me back for a routine ultrasound, which was not uncommon for me. It was every year, one side or the other was, typically they wanted to evaluate a little bit better. And after the ultrasound, the radiologist said, there's a little something there. We're not sure what it is. We want you to come back in 3 months so we can repeat the ultrasound and the mammogram. And then, I went home and I called my primary care physician and I immediately requested that he order a breast MRI, mainly because my sarcoma that I was diagnosed with in 2013, unfortunately, had been misdiagnosed for a few years. I had been complaining about symptoms. Unfortunately, at that time, I was self-employed and didn't have the greatest of health insurance, so trying to get the right diagnostic testing approved was a bit of a battle. So by the time that sarcoma was found, it had grown large enough for me to actually be able to feel it. So did not want to repeat that experience again because the sarcoma in 2013, it was a rare desmoid sarcoma. There are less than 900 cases a year. That required me to undergo major abdominal surgery, had to have my whole abdomen rebuilt and lost my left rectus muscle, my left obliques. Had a complication a few days after surgery, an intestinal obstruction from the weight of the tumor being removed, and then subsequently ended up losing a few inches of my ileum as a result of the intestinal obstruction. So definitely did not want to repeat that journey. So my primary care doc was wonderful, ordered the breast MRI, had that done. A couple of days later, I got a call from the radiologist letting me know that he had read it. He was leaving for vacation, and could I please come in the next day because he personally wanted to do the biopsy.
Wow.
And after the biopsy, I got a call a few days later letting me know that it was breast cancer. And then it took another week before I was able to know the hormone receptor status. And it took a while before the decision was made to do any sort of oncology genetics. So I had already met with oncologists. I had already had the lumpectomy, and they had decided to do oncogene testing because there was no history of breast cancer in my family. And at that point, I was 48, And it was my second cancer diagnosis before age 50. So that's when they decided to do the genetic testing, which then came back with a heterozygous variant in my TP53. So I was subsequently diagnosed with Li-Fraumeni syndrome, which ended up changing my entire treatment course. The original plan was just the lumpectomy, which I'd already had. Then it was going to be chemo and 7.5 weeks of radiation. But once they called me and told me that I was being diagnosed with Li-Fraumeni, I was actually scheduled for a repeat lumpectomy the next morning. They wanted to get a slightly wider margin. I had to call the hospital and cancel that, and I was literally told over the phone that I was going to need a bilateral mastectomy. So it totally changed my treatment course. Li-Fraumeni patients are strongly discouraged from having any exposure to radiation. So because of the diagnosis, radiation was no longer on the table for me. And because of the high risk of recurrence with Li-Fraumeni, that's why I ended up having to have the double mastectomy. So, and my case was pretty rare, being that most women with Li-Fraumeni, first of all, you have a 99.9% chance of developing breast cancer in
Mm.
your lifetime, but it's usually found in early 20s or at least by early 30s. So the fact that I was 48
Mm.
when I was diagnosed was, a little bit of an outlier, which my team at UPenn really attributed to what I do for a living, that they felt that, practicing what I preach as
Yeah.
an integrative and functional dietitian, definitely made an impact on providing me some extra benefits and preventative medicine for a
Mm.
few more years. But the first thing that my Li-Fraumeni specialist said is, I know what you do for a living. I know how active you are in the field, but I just need to give you some peace and tell you there was nothing you could have done. This was going to happen regardless.
Yeah, yeah. So maybe just take us through a little bit of some of the biggest sort of physical as well as emotional challenges that you experienced during obviously your diagnosis, your treatment, your recovery.
Yeah, I think physically people really underestimate how much cancer treatment takes from you,
Mm,
not just in terms of strength or energy, but in how your body really feels like it's no longer yours.
mm,
And for me, it was really challenging because I'd finally gotten to the place where I had, grieved the sarcoma journey, had gotten past some of the physical limitations that, that journey and some of the activities that, I really couldn't engage in as much anymore. If I did, I had to take a lot of extra precautions to make sure that I didn't have a fall or I didn't injure my abdomen or prevent, any sort of herniation. So then, it was one thing to process the lumpectomy, but yet I was still going to be able to, preserve my breast. And then being told that both of them were going to need to be amputated, that in and of itself was, life changing. It's part of your identity, and you really feel like you lose control
mm,
over your body.
mm,
The biggest challenge with any cancer patient, but I think for those of us in the Li-Fraumeni community, is the fear of the recurrence. Because for us, it's not so much of if there's going to be another cancer diagnosis, it's really a when.
mm,
So I undergo constant screening. So I get over 7 MRIs annually because I can't do CAT scans or PET scans. So various types of MRIs to evaluate every area of the body. And then on the 6 month mark, there is ultrasounds. Every 3 months, I'm getting, comprehensive labs done. So there is a constant element of scanxiety, as I call it, to try to stay 2 steps ahead. But the other thing is just, the vulnerability that you feel. There is a grieving process, recognizing that the me that I was in February of 2021, I'll never be that person again. So it's trying to hold space for myself as well as, friends and family, but also focusing on my own healing. I will say, one of the things that I've tried to really be a voice for in my local community is the aftercare. There are a lot of resources for cancer patients while you're going through treatment, But I think where we definitely have room for improvement is afterwards. When you finish chemo or you finish radiation, you ring a bell, you maybe get some flowers, you get a certificate, but the aftercare, it just kind of fades away. And I think a lot of cancer patients are left unsupported about how do you put together the pieces of your broken life. There's a lot of things that they really don't adequately prepare you for during treatment. The lingering side effects. Chemo brain is a very, very real thing. And I will say I took a lot of steps to protect my body as much as possible during treatment. Besides working with a medical oncologist, I was also working with a naturopathic doctor in the area who specialized in oncology. So I had a very comprehensive supplement regimen that I was using. I was manipulating my diet, so I was doing a modified fasting mimicking diet every week for the 12 weeks of Taxol treatment. I was using cryotherapy, so I was icing my hands and my feet to prevent any of the neuropathies that are common in cancer therapy. Good friend of mine is an integrative DO, so I was, and I still do, I retained my port for one of this main purpose. I still go for high dose vitamin C infusions. So, I've been throwing at it everything I possibly can from, during treatment to even trying to maximize my health afterwards. But there still are lingering symptoms. So, the side effects of chemotherapy that, impact your energy level, your response to heat and colds, the brain fog. For me, word finding tends to be the biggest challenge that I face from time to time. Then there's the emotional aspect with the fear of recurrence, the grief, the loss, and then the ongoing treatment that I'm on. So I am on an aromatase inhibitor, and that comes with its own set of side effects.
Mm.
So and those are things that I think a lot of patients aren't prepared for. Treatment isn't done when chemotherapy and or radiation is finished. It's,
Yeah.
it's lifelong. So it's been a journey, like learning who I am post breast cancer. And I also ended up with a skin cancer diagnosis during the breast cancer treatment. So that was diagnosis number three.
Wow.
And quite honestly, right now, I am awaiting results as to whether or not I have thyroid cancer. So part of the screening process, includes thyroid ultrasounds. So this past May, my recent ultrasound was flagged for biopsy, had the biopsy last week. Initial set of results,
Mm.
they couldn't tell whether it was benign or not. So it was a Bethesda category 3, which, flags it to be genetically tested. So those
Yeah.
samples have now been sent to Pittsburgh. So I'm
Wow.
awaiting that, but keeping my fingers crossed that diagnosis number 4 is not in my future.
It's just incredible to me. I think in some of the chats we've had prior to recording, I've just mentioned to you how you just seem to really just take it in your stride. I don't know if maybe that's a sort of a brave face that you put on, because you did mention that you recently had a little bit of a meltdown with
Yeah, yeah,
close to you and your circle. So that's absolutely human. But I think for the most part, it seems that you display this general sense of resilience and just, I've got to just get on with things and I've just got to deal with this and I've got to move forward. And has the knowledge of your genetics empowered you maybe a little bit in terms of
absolutely.
deal with this?
Absolutely. I think, and granted, I'm just as human as anybody else, and I've had my ugly cries and the woe is me, the why me. But then I also felt very, very blessed that I do have the knowledge and expertise. My husband is a family medicine physician. We have a wonderful family and support network and great clinicians. So I really had to force myself into the space of remembering the gifts that I have and being grateful. And also recognizing that not so much why is this happening to me, but what can I learn from this? What does this mean for me? What is this teaching me? And then, because of my career and my roles over the years, how could my journey be a teachable moment for others? I mean, even my oncologist will tell me, I learn something from you every time I see you. So, And I know that, through the discussions that I've had with him, other patients now are utilizing sauna, are utilizing fasting, are utilizing IV vitamin C. So if my journey has been able to at least impact one other life,
Mm.
then I'm happy. But I will say there is a cliche, but I firmly believe that there are some silver linings to diagnoses like cancer. And, it could be other very earth-shattering health conditions, chronic illnesses, but there are some gifts with it. It really put me in a position where I prioritize self-care. I tell everybody self-care is now my favorite hobby. It has given me the space and the grace to be able to decide, how do I want to spend my time? With whom do I want to spend my time? I'm a lot more comfortable saying no to things. I focus on things that empower me and bring me joy. I've been able to let go of relationships that just didn't serve me well and be at peace
Mm.
with it, and to really prioritize my time. And I love that Tim McGraw song, Live Like You're Dying, because I mean, I don't look at it as if I'm dying,
Yeah.
but I do recognize, I am a realist as well, that the Li-Fraumeni diagnosis does present, as my oncologist affectionately calls me, his ticking time bomb. And he gets away with it because we are friends. But still, I try to look at it through a realist's
Mm.
perspective, that I don't know when the next hurdle is going to present itself. So I find myself a lot more living in the present moment. So it does force me to be more present, to focus on today, and to make choices that are more supportive of my short-term goals, my short-term health and wellness. And I certainly don't want to wait until retirement to be able to experience things that life has to offer. Because granted, there's no guarantee for anyone,
Anyone.
but
Yeah.
I just know that there's a higher propensity for me to face challenges
Mm.
than my husband or other family members. So, and I look at that as a gift because I really do appreciate things more. Being in nature, like I've really felt a lot more connected
Mm.
to nature and spaces where I feel the impact of the energy, and just being able to appreciate this life and
Mm.
not, I knew I had a choice. I can either wallow in the sorrows.
Yeah.
I've even tried to avoid belonging to a lot of the different support groups that are available out there, and I think they're great. But for me, I found that it just put me in a mental space where I was focusing too much on the negative and, other people's negative. And I didn't want to choose that path. I wanted to stay more in a positive mindset.
Mm. I think that's a fabulous message, not only for other cancer patients, survivors, but just for your everyday person to really take the time out and to really just be grateful and thankful for the positive things in life and not to dwell on the negative. But I want to now jump into the genetics a little bit more. And
Yeah.
so I know you've spoken about, obviously the nutritional side of how you were supporting your body. I'd like to dive into a little bit of the fitness side, so the active
Hmm.
side. And we all know that exercise is considered medicine and that many doctors are prescribing exercise for a lot of chronic conditions these days. But what was your sort of exercise picture like pre your cancer diagnoses? And then how did that change and morph into something else afterwards? Because I know you're still pretty active, but tell us how that has morphed over time.
It was a pretty significant change for me. So prior to cancer, I was an avid Orange Theory member.
Mhm.
So I was doing 4 to 5 Orange Theory workouts a week. Absolutely loved it. I really like that kind of structure. Loved the machines, the coaches, and for me, the competitive nature of the splat points and trying to see how many splat points I could get with each workout. I was truly in the best shape that I had ever been. Then, the combination of the breast cancer journey, and unfortunately, it also happened to coincide with the pandemic.
Wow.
Um, so that had a significant impact as well because our local Orange Theory was opening, closing, just because of the different guidelines going through the pandemic. So, that had a significant impact in and of itself, was no longer having that access. And then undergoing cancer treatment during the pandemic, that was a whole subset of isolation because, being on chemotherapy, my oncologist definitely didn't want me out and about as much as possible. So that shifted a lot. My husband and I made the decision to actually invest in getting some good equipment here at the house. My treadmill had been 25 years old. So we did invest in a good treadmill. He wanted to get a bike. And then because of knowing my own genetics from my 3x4 panel and then the oncology side of things, we invested in a sauna. So we have a sauna here at the house too. But chemotherapy does take so much energy out of you. So I went from being able to do those endurance, strength, and power type workouts to like really just being able to do a slow walk
Mm.
on the treadmill. Movement was important to me though, like because of the energy impact that chemo has on you. I definitely needed to make sure that I was incorporating some degree of movement the entire time. So I was on chemo for 12 weeks, but then I had a year of Herceptin, which is an immunotherapy. And even that came with its own degree of side effects. So, movement, whether it was going to the local yoga studio and doing like a slow flow yoga, even chair yoga, like just movement in general felt so much better for me, but my endurance definitely took a major hit. Then it was more of the surgical repercussions that impacted my fitness journey. So the lumpectomy, then the bilateral mastectomy, and then I had to go back in 6 weeks later for them to also just do some tweaking to the mastectomy and the reconstruction. I had an area that wasn't healing properly, so they had to go back in and debride that.
Wow.
So, multiple cutting into your chest area, your pectoral muscles. So I ended up with a frozen shoulder.
Ah,
My right my right shoulder froze.
wow.
Um, and that was a year of physical therapy to get it to the point of unfreezing because I did not want steroid injections. And it was almost to the point where they were going to take me to the OR and manipulate my shoulder under anesthesia to try to just break up some of the adhesions. So that impacted, my whole upper body strength. To this day, I still haven't, 4.5 years later, I still haven't been able to get back to the point of my upper body strength. So, and my endurance, I can't work out to the level that I did back at Orange Theory. So I do a bit of a combination. I still do treadmill workouts. I have a rebounder, which I really enjoy. So, because I do work remotely, so I try to stay pretty structured throughout my day. So I do try to just hit the noon news sometimes, and if I'm watching the 12 o'clock news, I'm on the rebounder
Mm.
at the same time. If I'm watching the evening news at night, I'm on the treadmill. So I try to make sure that I'm maximizing.
Mm.
But the rebounder, my vibration plate, and the treadmill, because it is an incline treadmill. So right now I'm doing a series where I kind of walk jogging through Portugal. So
Oh,
so that helps to kind of take your mind off of the workout side of things. And
yeah.
then I do some strength training. Immediately after the mastectomy, I did work with a Pilates instructor as
Mhm.
well to help improve the range of motion. So my physical therapy was also like a modified
Mm.
Pilates. I do like yoga, dance.
Okay.
I've been an Irish dancer since childhood, so
Oh,
that's something that brings me some joy, although my knee is not so happy with that anymore after, dancing for
mm,
45 years.
mm,
So,
mm,
but, I've had to come to terms with the fact that I may not be able to get to the level of strength in terms of weightlifting as what I previously had been,
mm,
but I'm happy for what my body still can do. So that's the way I look at it. And for me, fitness is no longer about exercise and burning calories or the cardio benefit. It's more about the emotional, the physical, the mental, the energy gift. So I look at fitness now from a more comprehensive perspective and actually thank my body for what it is able to do. I recognize the limitations, but I'm grateful for what I can do.
Did you make use of your activity genetics in understanding how you should be stressing your body when it comes to activity? Because obviously that's a fundamental part of making the decision of, okay, I'm in recovery now from some serious surgery, from
Yeah.
disease states. How am I best going to support my body when it comes to exercise and activity? So share with us a little bit about what you gleaned from the genetics to help you put together like a training or fitness regime.
Yeah. So, unfortunately, I didn't necessarily get the best poker hand and what I was dealt genetically wise. So, yes, I did, throughout the entire journey, having done my 3x4 panel made a huge impact because I even had discussions with my oncologist and my naturopathic oncologist about the SNPs that I carry that impact my detoxification, high histamine, inflammation. While I was awaiting my hormone receptor status, having already had my nutrigenetics done, I was able to look in and thought, I really had a strong sneaking suspicion that triple positive was what I was going to end up being. But when it came to the activity side of things, I knew I also just needed to acknowledge and take that into consideration. So I do have low to normal training response. I am prone to soft tissue injuries, which I had long been aware of, especially from the Irish dancing, because, I've had some knee problems and IT band issues, some ankle rolls over the years, sprained my ankles quite a few times. So, and then endurance and power, though, they were both medium impact for me. So I knew that my body, endurance wise, would respond
Mm.
moderately to training and moderately to power. But I really also wanted to be cognizant of, recognizing that I am at higher risk for soft tissue injuries. And I also was high impact in my recovery pathway. So definitely had to make sure that I was giving myself rest days. I was mindful of what type of activity I was doing. So making sure that I was warming up adequately, that I was stretching. So that's where the Pilates and the yoga were also part of the regimen that,
Yeah.
I wanted to make sure that I was still doing movement and activity, but
Mm.
recognizing that even more so now, because of the journey, that I really needed to not necessarily baby my body, but just be mindful of where my strengths and limitations were. So that came into play. My supplement regimen, I also used my genetics to
Mm.
really inform not only my dietary choices, but also, my lifestyle and my supplement choices.
Yeah, yeah. So, in your fitness journey that you're currently in at the moment, I know you said sometimes it still feels hard and then energy levels are low, and I think anybody who is active and does exercise will have better days and worse days. So I think it's not only somebody who's dealing with a cancer diagnosis like you, but do you feel that maybe one exercise is better for you over another? I mean, we have seen in your genetics that you are pretty balanced in terms of your response to endurance and power. So you probably, it's just interesting for me to ask you these questions because I think inherently we've always got this feeling of I kind of know my genetics because I feel better doing this kind of activity. I know that I take longer to improve my fitness. I know inherently that I need more recovery. Did you inherently know these kind of things before you had the genetics done, and then the genetics kind of just validated it?
Absolutely. Absolutely. I definitely knew that I needed rest days after more strenuous workouts, that I didn't bounce back
Mm,
as quickly as other people did. And it was something that I had talked to personal trainers about a lot even before I did the genetics. Is if we do a very intensive workout, it kind of knocks me down for a couple of
mm,
days. I really needed that time to rest. And now I prioritize. Like if there are days where I really just don't feel like I have it in me to do a more strenuous workout, then I'm at least doing a walk. Thankfully, there's a couple of really nice trails close to our house that it's just, well, let's just get outside in nature. So just doing a walk, it doesn't need to even be a strenuous hike,
mm.
but just being outside. And
It almost gives you that freedom, knowing
yes.
your genetics. You have that freedom to make those kind of decisions for yourself, where maybe previously and not knowing your genetics, you kind of, am I just being lazy?
I think it really helps to, and I share the same with my patients as to one of the reasons why I think it's so important
Mm,
to look at their genes because it can give you some peace of mind and it can confirm
mm,
what somebody might already have been suspicious of in terms of their genetics. So, yes, it helps to explain a lot of the why of our experiences. We come with the what we're dealing with, but our
mm.
genetics also just reinforce and confirm the whys behind. So for me, it confirmed when I got my first blueprint, it was very eye-opening and reassuring because, I've had rheumatoid arthritis my entire life. I tended to gravitate towards, more inflammatory processes. I knew that hormone balance had always been a struggle for me, more estrogen dominant. I had struggled greatly with my weight when I was younger. So my genetics just really cemented for me that yes, a lot of this stuff wasn't necessarily in my head.
Yeah, it was real.
It truly is in my genes. So I think that is truly one of the gifts that we have. Having access to this knowledge really empowers your decision making and allows you to personalize and recognize what you can maximize and take advantage of, and
Mm,
just where do you need to approach things with a more intentional, mindful approach because you want to be able to support your body
yeah.
as much as possible. So I'm very grateful for all of the knowledge that I've been able to gather because it truly has informed all of my diet, my lifestyle, my supplement regimen. It's just, to be able to take it to that level of personalization is just so important.
Yeah. So maybe you could give us a little bit of insight into your nutritional strategies. I mean, we've spoken about the exercise side of things, but what about you mentioned sauna as well. So let's unpack a little bit around the nutrition lifestyle strategies, because I think people will have lots of questions around that too.
Yes. So between the Li-Fraumeni diagnosis and also knowing my genetics and family history, so I do follow a more lower carbohydrate regimen. We, all organic. We've always been strictly organic, and I live in an area where I have a lot of access to organic produce and even, organic meats. I do also keto cycle.
Okay.
Personally, I feel much better in ketosis, and keto is a whole nother discussion.
Yes.
But for me personally, I feel much better in ketosis than out of ketosis. So I do a bit of keto cycling, carb
Mm,
cycling. I feel better that way. I also still will do a round of a fasting mimicking protocol every 3 to 4 months. I've been doing that for years, even long before the breast cancer diagnosis. So I've been doing that for about 8 years now. So I do that. I do the sauna, our far infrared sauna. So I'm in there at least 3 to 4 times per week for about 20 minutes. And then I have a very extensive supplement regimen that continually tweaking with my naturopathic oncologist. And then always doing an additional battery of functional labs
Mm.
to then inform our decision making with my supplements.
Okay. And are the supplements targeting specifically things like inflammation, oxidative stress, detox? What are you targeting with your nutritional interventions?
Definitely the inflammation and detoxification. Also in ensuring that, I'm supporting metabolically. So there is, my mother, my father, and my brother, all three diabetic. Fortunately, my blood sugars have always been good. My A1C is good. My fasting insulin is good. But I also want to make sure that my glucose pathways are being supported micronutrient wise. I also, because of the loss of part of my ileum, there's some targeted micronutrients that I need to hone in on. That has also caused me, unfortunately, to need iron infusions from time to time, that regardless of, how much dietary iron I consume and even, iron supplementation, about once a year, I need to go in for just an iron infusion.
Okay.
And then I still go for the high dose vitamin C infusion. So I do two complete cycles a year. So each cycle is 3 to 4 infusions separated by 3 weeks.
Okay.
So it takes a few months for each cycle. So I'll be starting the next one soon. So I usually do one over the fall, early winter, then take winter off, and then I do another one in late spring into early summer.
Okay, and then you mentioned the fasting. I mean, you were doing that before even the cancer. So, what was your reasoning behind the fasting, and what kind of protocol do you use?
So, ironically, I've been naturally a faster since childhood. And I'll be the first one to throw the caveat out there that the majority of the research supports fasting in alignment with your circadian rhythm. So not skipping breakfast,
Mm.
but I'm also a realist and I try to look at each person's regimen separately. And for me, breakfast just never really appealed to me. I'm not necessarily hungry early in the morning. And, I've always tried to honor my body's signals.
Mm.
So I do, years ago, I was doing more of a 16 and 8 type of time restricted feeding. Now I'm more of a 14-10 type regimen that I've followed. And ironically, when I was doing all of the research for the stem cell activation diet book, it was just kind of empowering to me because it was like, well, yeah, this is kind of what I was just naturally doing just by honing in and honoring what my body was telling me and what had me feeling
Yeah.
best. But, when I'm talking to other patients about fasting, I do impress upon them that, the body of evidence really supports that you want to kind of, eat your breakfast and cut off in the evening. But again, we really need to tailor our interventions to what's most realistic for the individual. So that's what works for me. I think it's important for people to explore what works best
Yeah.
for them,
Yes.
working in conjunction with a knowledgeable clinician.
And I think, yeah, I mean, just in terms of activity and exercise, I think often there is a recommendation to maybe implement a fasting protocol. But if you're
Mhm.
working with an athlete who really is not going to work well off that, especially our female athletes, which it may not
Right.
necessarily be the best thing for, really, like you say, should be working with a clinician who knows how to steer you in the correct direction when it comes to these kind of protocols and not just taking what the latest fad is out.
Exactly.
Yeah.
Exactly. There is no one size fits all.
Yeah.
I tell my patients there's not even a one size fits most.
Yeah.
And,
Yeah.
and genetics proves that.
Yeah.
And I think the biggest challenge in our space, and I've even seen this in the oncology space as well, is the influence that social media has.
Mm.
That was very frustrating. Like even just when I was participating in some of the online support groups for breast cancer and Li-Fraumeni, the amount of misinformation that was being disseminated in these spaces. And I had to be very cautious about what I contributed, because of what I do for a living and, wanting to stay within my scope and also protecting my license and recognize that I'm in that group as a peer, not as a clinician. And I would just comment reinforcing please check the references, please make sure that you're getting your information from, knowledgeable, licensed clinicians, things like that. But even in the sports and fitness realm, I mean, there is just so much misinformation. So it's really challenging for folks to try to navigate through the weeds of the amount of information that they're being subjected to. I mean, it's hard for us even as clinicians to kind of weed out stuff.
Yeah.
So I often find that in many of my sessions with my patients, the first half hour, I'm literally unraveling all of the, just the wrong information or the preconceived, ill-derived notions that they come into the session with, and constantly hearing, well, they say, well, tell me who they is and what is their credentials. So, and that's where, fasting, I mean, fasting has been around since the dawn of time. If you look at every single major religion around the planet, they all have some element of fasting. But, it's really been kind of like the buzzword for the last 10 years. And I think some people do it to the extreme. And I'm always very cautious with my female patients, especially my gals who are, perimenopausal. If there's any thyroid barriers, that whole HPAT access we need to be cautious of. So I'm just a big proponent for, really working with a clinician before you decide to make any sweeping changes. If you're going to be on any sort of restricted diet, restricted plan, multiple supplements, you really need to be working with somebody who can help you structure a proper plan for you.
Definitely, definitely. Lots of words of wisdom, and we are running out of time, so we are going to have to close. But just in closing, Dana, what would be your, I mean, you have been in a space where you've had ready access to genetics and you've had, you're in the functional nutrition space. A lot of people listening to this are not in that space and don't readily have access to these type of things. What are your parting words of wisdom in terms of if they are dealing with cancer or any type of chronic disease, how should they reach out? What should they be looking for out there in terms of resources that they could use to help them in their journey?
Advocate, advocate, advocate. That's the biggest lesson that I've learned. Don't be afraid to advocate for yourself.
Mm.
Absolutely don't be afraid to ask for help. Nobody is expecting people facing chronic illnesses and cancer diagnoses to be a superhero. So there's nothing wrong with acknowledging what your limitations are and recognize that, honor your body's limitations. That's one of the greatest gifts that you can give it. And self-care is never selfish.
Mm.
So, if you have to take care of you. But as far as reaching out, explore the resources. Make sure that the members of your care team are collaborative with you, and that shared decision making is always part of the conversation. And you know your body better than anyone else. And I've always told my clients, I don't care how much alphabet soup is behind a clinician's last name,
Mm.
you still are the captain of your body. So if you have an intuitive instinct that something else is wrong, or you don't understand the regimen that is being recommended to you, or there's anything that is giving you reason to pause and to question, follow that. It should never be a dictatorship in your clinical care. It has to be collaborative. So I think that that's one of the biggest things that folks can do is don't be afraid to question, don't be afraid to advocate, connect with your resources. There are a lot of services that are available out there. Somebody anonymously sent me a care package box through the Pennsylvania Breast Cancer Coalition, and that was such a great gift. Like there were so many wonderful resources and tools in that physical box that I was sent. So do take advantage of friends and family who are willing to step up and be there
Yeah.
for you, and take advantage of the resources that are available. And if you do have the opportunity to do genetic testing, hands down, it can be life changing for you to really be able to takes such a deep dive and a level of personalization that you can't get anywhere else.
Sure. And Dana, maybe you can just point people in the right direction if they are looking for a genetic test. Where can we find, I mean, obviously 3x4genetics.com is the website, but we've also got our new 3x4 Health app where
Yes.
people can access a test directly. So maybe you just want to speak to that.
Yeah, I think that that's a great option, and it's not cost prohibitive as compared to other things that folks might invest money in. If you look at it from a return on investment, there's definitely a really good ROI to be able to not only use the app to walk with you
Mm.
on the health journey and be able to give you insights and feedback into your own genetics and personalization. And then you have the opportunity that if you so choose to work with a clinician who is knowledgeable and familiar with 3x4, I think that is somebody, if that's something that somebody has access to or wants to do, I would strongly encourage that because that clinician is going to be able to, take a deeper dive
Mm.
with you and really help you connect the dots. So being able to order the kit yourself is great to, have the access. The app is a really, really useful tool. And then being able to take it one step further and working with a clinician who can really help flesh out for you, factoring in your own journey and your personal history, and really being able to connect the dots for you with your genetics.
Yeah, absolutely. Fabulous. Well, thank you so much for a really informative chat today. I hope our listeners have enjoyed it and gleaned some good information from it, which I'm sure they have. And I think maybe there are a couple of topics that maybe you brought up in this conversation that we'll have to explore today.
A little deeper. Yeah.
But yeah, Dana, thank you so much for joining us. Cheers.
Thank you. I appreciate it.